Well, good afternoon. Thanks for being here. I'm going to get right to the point today. Our healthcare systems are surging, and our healthcare workers are extremely busy right now with both COVID and non-COVID cases. They are managing, but they are busy. They're implementing their surge strategies to deal with this increased demand. And so first off, frontline medical staff, we see you, we notice you, we appreciate the work you're doing right now. But we're in a tense spot. And quite honestly, we need this region and each of you to do your part. We need more. Our schools need you to do more. Our hospitals need you to do more. Our vulnerable populations need this community, this region to do more. And I have an expectation of residents, and I'm not just talking residents of Sioux Falls, I'm talking to our entire region right now. The majority of the inpatients in our Sioux Falls hospitals are not from Sioux Falls, from all over. This reinforces that there's a level of diligence across this region that we need right now. Approximately 15 to 20% of staffed beds right now are being used for COVID. What that signals is that deferred care is also becoming an increasing issue in our hospitals. Let me stress, if you are over the age of 65, you need to be extra diligent right now. I'm not going to tell you what to do if you're in that age bracket. You need to be diligent, you need to be responsible for your situation. Friday, myself and the mayors of the 16 largest cities in the state, we represent roughly over half of South Dakota's population. We sent out a unified message of what we need from our communities right now, from this region. Wear a dang mask when you're indoors. We're not asking you to sign up for the draft here. We're asking you to wear a mask when you're inside and you can't distance. Social distance, take that seriously. We have let down our guard tremendously on that. That needs to be taken seriously. The hand hygiene protocols. This is stuff that shouldn't be a surprise. We've been talking about it since March, but now we're at the time when we need the diligence on these items. You know, the current political tensions in this country are certainly impacting this issue and impacting us as leaders at a local level. Part of my job as a leader of this city is to take action as well as to avoid action to ensure we remain as unified as we can right now and avoid division and chaos in a tense local and national dialogue that exists. You're going to continue to see strong expectations from myself and those other 16 mayors across the state asking our residents, again, to do their part. We need you to do your part. This is a chart we're not proud of. This is a trend we need to reverse. You've all seen it. You see it every day. We're getting a lot of attention over our increased hospitalizations, our increase in active cases. This is the trend we have to reverse. So one of the messaging components you're going to start seeing is this. In partnership with Sanford and Avera, we're promoting mask wearing whenever we can. This entire room is masked up. You're going to see a lot of these campaigns in the community. You're going to see billboards. You're going to see social media campaigns. You're going to see PSAs. We need you to mask up right now, and we need you to take that seriously. I am not sure when or why this issue became so dang political. It's quite ridiculous, if you ask me, how political this has become. This is not an R or a D issue. This is a public health issue. And at times I'm embarrassed about how politicized this has become. There's a lot of anger right now. There's a lot of fear over this virus. And what I'm asking you to do today as well is try to control that anger and that fear. We will get on the other side of this. But I'm also asking for a level of unselfishness that, quite honestly, many people are not used to giving. That's unselfishness that says, I'll wear a mask for other people. I'll avoid groups. I'll avoid large social gatherings on the weekends. I'll think of others before myself. And so if you want to live in a state that gives you freedoms, that comes with an expectation of responsibility. And I need this region to do more right now. I'm going to turn over to Dr. Basil with Avera.
Thank you, Mayor. Yeah, there's no doubt that we have seen a significant increase in hospitalized cases over the last month or so. Probably the numbers have roughly doubled in that time. We have initiated early stages of our surveillance plan. One of the nice things is that we had a good run of using our surveillance plan last spring. This time it's going to be more of a stepwise process, and so we're trying to keep as many things open, as many things running at all times, because we can't just keep deferring that care. We've got to make sure that we're doing all those things to prevent strokes, to prevent cancer, to keep people's diabetes under control. All of those things, this has turned into a marathon, not a sprint, and so we've got to keep all of our long-term care going at the same time we're managing these increasing COVID cases. So some of the early stages, some things that we've been doing. So for example, we've opened up more ICU beds. If you'd asked me 6 months ago how many ICU beds in your main medical ICU, I would have said 20. Over the last couple of weeks, we've increased that into the mid-30s already, and we plan to increase that further this week to care for those increasing cases. That's one of the reasons why when you ask me, do you have any beds, we've got surge plans so that we can ever increase that number of beds to meet that demand, and we're still confident that we have the ability to do that. But there is a limit to that, and so we will keep a stepwise, increasing, asking people to work more shifts, being able to handle that surge. We do see ongoing that, all projections are showing we're not done yet. With the number of cases that we're seeing, the percent positivity that we're seeing out in our communities, that number is going to continue to increase and potentially increase pretty significantly over the next month. And so we have plans in place to handle that. But I do agree, Mayor, that we do need the public's help with this. There's a limit to how far we can increase. We also agree that we've got to keep as many things open, our schools, our businesses, our economy, as much as possible. Our ability to do that depends on each and every one of you, and how can you help? Masking is probably first and most important. Masks work. Back in February, we didn't know whether masks worked for COVID. Now we have solid data, masks work, and they work pretty significantly. Where we're seeing it spread mostly is when people aren't wearing their masks, sitting down at a table together during their lunch break, within the healthcare system. We're not seeing cases getting transferred, between a patient and a healthcare worker. We're seeing it because they sit down in the break room or sit down at a lunch table. Those are some of the changes that we've had to make that's proven to us that masks do work, because when we're wearing the masks, we don't see the transmission. When we don't, we do. You mentioned large gatherings. That certainly is a time where one person can infect many, but small gatherings are also important, especially now as we're coming indoors as the weather gets colder. An outdoor gathering is certainly less risky than an indoor, and even small groups as you come indoors, think about, how you can incorporate masking into that when you get just a few families that come together, how you can reduce the spread in those settings. We flattened the curve this spring. We can do that again now while still keeping as many things open as we can. My kids are in soccer this fall. I want them to be able to continue doing activities like that as long as we all do them safely. Another way that we can help with that is if you have even mild symptoms, stay home. There is so much overlap on the milder cases between the common cold and other common mild infections that you really can't tell. There's certain things, if you lose taste and smell, you have COVID. But there's so many other things, mild cough, runny nose, stomach upset, those sorts of things that can be COVID and be pretty mild. And so if you have any of those symptoms, don't go to work, don't go to school, get yourself tested so that we can get you ruled out and isolated. And isolate until you get that test result back. We are working diligently to decrease the turnaround time so that we can get those results back to you quickly for that. And also important is if you are within close contact to somebody who is positive, even though you feel fine, it's so vitally important that you stay away from others and isolate for that 14-day period, because it can take 5 to 14 days for symptoms to show up after a single exposure to somebody who's been positive. And so there's no way of knowing or predicting. We can give you a test, but just because that test is negative doesn't mean you're not going to turn positive later on. And you could start infecting people days before you ever turn symptomatic. So it's so important to stay isolated during that time period. I mentioned that we're trying to improve access to testing and continually increasing the number of tests that we can run on a daily basis. One of the next steps that we have in that process is that we are this week opening up a new testing location for drive-thrus at 23rd in Minnesota. So that's an old Vern ID location that was bought by Silver Star, and they graciously did a short-term lease for us so that we can have another testing location other than our West Side location, and we can really reduce the wait time for people that need to get that test. And so we're really excited about that ability to reduce the barriers to get testing go through. And so I think that'll be a real step forward for us and for the city. Lastly, I just want to say thank you. Thank you to the public that is already doing so much. I was at church this weekend. 95% of the people in church were wearing masks. They're doing their part. Thank you. Thank you to all of the workers in grocery stores and other businesses that are working and keeping things running as this goes on and on. But most importantly, I want to thank you to the healthcare workers, the frontline workers, the support workers who are helping us care for all these patients. Again, we are asking for extra shifts from individuals. We are asking for longer hours from nurses and care techs and social workers and first responders and everybody. And it's taken its toll over time. But we stay strong, we stay positive. Sometimes it's hard. There are so many tragic cases that we have to deal with COVID daily. Families, husband-wife teams that come down with it, and one of them makes it and the other one doesn't. The way it spreads through households and just hits one after another can just be so big of a tragedy. And to healthcare workers, that takes a toll on them. And so thank you for everything you do. You are making a difference, and you will continue to make a difference. Thank you.
Thanks, Dr. Basil, and Mayor as well, and good afternoon. I'm going to start with a thank you as well. As Dr. Basil pointed out, there's a lot of people in traditional healthcare roles, but also those that teach, those that coach, those that work in the restaurants, grocery stores, et cetera, really stepping up during this time. And sincere thanks to them. Thanks to all those that work within our facilities as well, those folks that are answering the call at all hours, even though they expect, to maybe be able to relax a little bit. And we absolutely want people to focus on that, but there's times when people will step up as well to help us take care of those coming to us in need. As already stated, we continue to see COVID, but also patients coming to us for non-COVID needs as well. And I've talked now a couple of times about this typically is a busier time of year, and that certainly continues for patients not only with COVID, but other needs outside of COVID as well. One of those, as the mayor pointed out, being needs that care needs that perhaps were deferred earlier in the year. and now are being addressed and may take a little more complexity in their care to get that addressed at this time. We continue to prioritize really that care closest to home, what makes sense, and a lot of people are working to achieve that as well. A lot of people come to us asking, what can I do? And a thanks also, like I said, like everyone has said so far, to those folks that are really engaged in helping to fight this pandemic. And patients do come to us asking, what can I do? And it's really a thanks for listening to the message and being willing to listen with an open mind as to what I can do, even though I may not necessarily be around a lot of patients in my community or a lot of people in my community. We're seeing that those populations as well are vulnerable at this time. This virus does get to visit everywhere. And so some of the things that we see from a hospital standpoint, but just taking care of yourselves. Group gatherings has been mentioned, and I think now's a good time to probably talk about your holiday plans. Unfortunately, due to this pandemic, there may have to be some alterations this year. And people just need to, and I have tremendous confidence in people to thoughtfully have a conversation with your families, your loved ones, those around you to, hey, what's Thanksgiving? What's Christmas? What's that going to look like this year? Do we travel? Do we get together in a large group, or does it just not make sense right now? Another thing, and we encourage this in times of pandemic, just really any time, and that is to focus as a patient on your advanced care planning. You have the ability to make your wishes known at any time during your care. And usually when the care is more acute is maybe not the best time, but rather if you're having a routine follow-up visit with your physician or nurse practitioner or PA, talk to them about your advanced care plan. Does it include hospitalization? Does it include life support or aggressive care like that? Or is it more a focus on comfort? And we have, in our primary care offices, that availability is there to have that thoughtful conversation. I've been involved with many powerful patient interactions where the family may have to step up and make that decision on a loved one's behalf, and it can be really helpful to have those wishes, and it has been really helpful to have those wishes really spelled out as those needs may arise. The next thing, if you do need to be hospitalized, start planning about how a discharge from the hospital is going to look. Have conversations with family, loved ones, coworkers, etc. We typically are able to be very transparent with you during your care as to, hey, it's looking like maybe the next day or two we could probably get out of here. How are you going to get home? Is someone going to come get you? Did you drive yourself? Are you able to drive now? And just things like that can really help us as we transition patients from the hospital to the home care setting. And I'll just wrap up with, as I alluded to earlier, really a thanks to everyone who's stepping up during these really challenging times, working hard to meet patients' needs as close to as home as possible. We had a very powerful interaction with our Good Sam facilities, Good Samaritan facilities, in addition to our network facilities. As you know, we not only have the facilities here in Sioux Falls, but across the upper Midwest, western Minnesota, northern Nebraska, northwest Iowa, and eastern South Dakota. And the ask at that time of the network and the Good Sam facilities is, what can we do? And certainly our network facilities have been caring for patients with needs as they can meet them as close to home as possible. But then some of these folks that we take care of in the hospital here can be difficult to transition to home, and they may need to stay at one of our outlying facilities for a couple of days as they recover. Our Good Sam facilities stepping up to say, even though we're stressed from a staffing standpoint, we're going to step up and work with some of these patients as well to help them transition to home. So really a humbling time, a busy time, and continue to work hard to meet patients' needs.